Well, for more on this, I'm joined by Betty Chetcuti, who's a psychologist and a director at the Australian Association of Psychologists. Good evening to you, Betty. Thank you for your time.
Good evening, Kat.
Now, as we heard in that story, Dan Andrews has committed to implementing all of those 65 recommendations, which he said would serve as a blueprint for the biggest social reform in a generation. But in your opinion, will it fix the system which has catastrophically failed to live up to expectations?
Yes, well, I've listened to the interview with Penny Armitage, who's the chair of the Royal Commission, and she had a lot to say in terms of the system, the failure, and we're really wanting to spend a lot more time looking in detail at each of those 65 recommendations. And at our association, we're well aware of the failure of the system over not just the decades, but in detail. There are just a wide range of issues that we're wanting to address.
Let's have a look at some of those recommendations then that were supposed to go to addressing the failures in the system that many witnesses brought forward during that Royal Commission investigation. The report found that under-resourcing and over-reliance on medication was present. Will recommendations address those issues?
Yeah, so what we're wanting to do, we hear this many times as a psychologist in my own practice and when we hear from our members. As a board director of the Australian Association of Psychologists, we hear widely from our members about what they're encountering within their professional private practices, and it's that same old there's not enough access, there's supply and demand are out of sync. So we're really wanting to increase that, and so looking at some recommendations in terms of having a workforce of 5,000 provisional psychologists who are adequately and appropriately trained for at least 4 to 5 years, and they're in their final years of supervision. We'd like to have a look at implementing that or deploying those psychologists for the Australian public so that they can be available to boost services. That's one of the areas that we'd really like to look at. We'd also like to look at increasing the access in terms of, the clients can't afford the professional fees. And I've said it before, psychologists can't keep discounting their fees. Whereas if we can have a look at increasing the Medicare rebate that hasn't changed in over 10 years, beyond $2 increases over 10 years, that's woeful as well. And, we need to increase that to a minimum of $150, and that's for every single psychologist. We need to cease a differentiation that has existed since around 2010. There's a range of implementations there. Really having a look at speaking to the immediate need to support private practice psychologists, looking to reduce the red tape. During the bushfire crisis, the Australian public was able to self-refer. And what we're wanting to do is to continue that, because there was immediate access. People that were in distress didn't need to go through the red tape of finding their GP, looking for a psychologist, making the appointment, going back after a 6th session and then a 4th session, and then now we've got a 10th session. There's just too much red tape. And we really need to learn from what has happened with not just the bushfire season, but also the awful experiences of COVID-19. We need to,
Betty, if I can just interrupt you there, you mentioned the financial access being an issue there. What about the geographic access? We know that there was a recommendation for about 50 to 60 new adult or older adult local mental health services for hours to be extended there and to be put out into the regions as well. Is that a good start?
That's a great start, because wherever we start, we need to start looking at taking small steps. And because that's going to be sustainable. And we need to make sure that, as per this Royal Commission, what we've done is we've had a really good look at it. And if anyone's heard what Penny Armitage said, she's right on the ball with a whole lot of her key statements in terms, the foundations are broken. The system's catastrophically failed. And we need to start at least with that. And then, as psychologists and as part of the board that I'm involved in, it's really working closely with government so we can feed back what we're hearing from our clients, who are the Australian public, and feeding that back to government to develop really good policy based on evidence.
Speaking about that supply and demand area, I mean, we heard some shocking testimony throughout this, but this idea that people are being turned away because they're not sick enough, they're not suicidal enough, and to think that that's happening, it almost beggars belief. How do you stop that from happening? Does the report address this?
It's extraordinarily distressing to hear we hear reports of this for clients that have presented in my clinic and other peers. And what we really are needing to do is improve that community-based service that Penny was alluding to in her interview, and also within the Commission report. Really needed to have more access for private psychologists, to have adequately funded sessions so that psychologists can continue to provide adequate treatment. And it's she also referred to the overuse of medication. I mean, that's required at times, but what we're dealing here with are emotional, behavioural and cognitive issues, and that's the realm of the psychologist. That's what we are adequately and extensively trained on, and we have ongoing supervision and ongoing training every single year to build and maintain our competence. And that's the work that we want to keep doing, Kat. And we really think the government help us to continue doing this work. And not only in regional Victoria, but also within urban, we really need to continue the telehealth that the government hasn't given us a response on. And we've got 31st of March being the deadline, and we still would really like to hear back from the government immediately to decrease the distress.
How confident are you, Betty, that the system will be fixed as a result of this Royal Commission?
What we'd really like to do is look at it in terms of starting, as I was saying, in small steps and working very closely. If we're going to make vast changes that are only going to be in isolation of working with the practitioners, we really need to build on our expertise and our experience. And I'm confident, and I'm hopeful, and I'm excited, as per one of the other members of the public that was interviewed, that this Royal Commission is going to bring what we need. It needs to bring some aid and support to a system that is fundamentally flawed. And we really need to work with psychologists, and the board, like the Australian Association of Psychologists, is working really heavily at working closely with government, and we've developed really strong relationships with government to be able to bring the concerns of the public directly to the policymakers so that they can be heard. We really want the Australian public to be heard, and they deserve to be heard, and they do not deserve to wait for a service. It's appalling that they need to wait for service, and it's distressing to psychologists that they need to wait. And the burden often falls on the psychologists to be able to meet that demand, but there's only so many psychologists, and what we really need to do is make use of supporting the professionals and building on that workforce of 5,000 provisional psychologists that I was referring to earlier, so that we can immediately boost that access.
And Betty, just one final question.
Sure.
This is obviously pertaining this report to Victoria alone, but we know that mental health is an issue across the nation. Should the other states and territories be looking at this and learning and implementing something similarly? What do you suggest should come of this from a national perspective?
Yes, the issues that have been raised in this report are national. I mean, we're talking about people. We're talking about a mental health system. And we really need to look to learn from one another as well. And there might be some policies that are, in different states that we can look to learn from. But what has been contained in terms of these 65 recommendations, we really need to look closely at this as a nation, just to show that we're really serious about delivering mental health to the Australian public. The very best mental health, the very best workforce being registered psychologists. And, for anyone who's listening to this and who is in distress, we really need to, just urge you to, speak to your doctor, see if you can get a referral to a psychologist. These are really difficult times. We're in and out of, lockdowns and restrictions. And, this Royal Commission has come at a really great time, because we can build on the experience of what we have just gone through. And we can build on the experience of our relationships with government. So we can strengthen those ties and build on the evidence of what clients need and what psychologists can do to deliver the services that the Australian public so desperately needs.
Betty Chetcuti, it's always great to talk to you. Thank you very much for joining us.
Thank you.